Good morning, everyone. I am Dr. Gargi Saran from the Department of Oral Medicine and Radiology, and today I'll be taking the lecture on projection geometry. A radiograph is a two-dimensional representation of a three-dimensional object. The principles of projection geometry describes the effect of focal spot and its position relative to the object and the film on the image clarity, magnification, and distortion. Using these principles, one can maximize image clarity, minimize the distortion, and localize the objects in the imaging field. So what is an ideal radiograph? According to H.M. Worth words, an ideal radiograph is one which has desired density and overall blackness and which shows the part completely without any distortion with maximum details and has the right amount of contrast to make the details fully apparent. The characteristics of ideal radiograph can be broadly classified in three categories. First one is the visual characteristics, that is density and contrast. Second category is geometric characteristics, that is sharpness or detail, resolution or definition, magnification and distortion. The third category is anatomical accuracy of radiographic images, adequate coverage of the anatomic lesion of the interest. Then visual, now we will learn or read or understand about detailing, that is detailing of the image quality through visual characteristics, that is density. Density, it is the overall blackness or darkness of a dental radiograph. Dental X-ray image characteristics include both visual and geometric characteristics. So in this, we can see the radiolucent area, that is dark gray to black. This is more dense. The density of the structure that lack density and appear more radiolucent, example is soft tissue and spaces. So this is less dense as there is no density in this, in the particular region where the soft tissues are overlapping and spaces, and it appears more radiolucent, that is dark gray to black in color. Whereas radio opaque has high density, which is structures like enamel, dentine and bone. They absorb the X-ray rays and become more dense. Density represents the degree of darkening of an exposed X-ray film from white to black. The overall density of the film affects the diagnostic value of the film. Ideal density should be not very, over here we can see in the extreme light is very dark radiograph, whereas in the left side we can see very light radiograph. But in between the both, it is the accurate density where the more shades of gray are seen, and the contrast is also good, and it is neither too dark or too light. So the middle one is the ideal dense in color and in visualization also. Now density is influenced by MA, KV. MA, these are the exposure factors that influence the density, and the exposure time is also there. Object thickness, object density, and film fog. So object thickness is also there. When is the more fat tissue is there, then object thickness matters in the exposure parameters. Then object density, that supposedly if there are restorative materials, so they will opaque more dense than compared to radiolucent regions like your KVs. And film fog. Film fog is just an effect of scattered radiation, that is unwanted radiation that has been uh, accounted because of improper alignment of the X-ray tube and the source and the object, and so film fog is created due to increased number of scattered radiation. Now, exposure factors and unnecessary increase in any of these factors result in increase in film density. Object thickness, the larger the patient's head, the more X-ray that are needed to produce an ideal film density. So we have to increase the exposure time, as well as we have to increase the kV of that particular if we are taking, if we are shooting of a very thick head, or if we are shooting a patient with a more fat tissue, so we should increase the exposure parameters also. And object density, supposedly if there is restoration material to structure, composite, etc., and the amount of material is utilized, so in that cases also we should adjust the kV exposure times, MA and KVP accordingly, and then shoot a radiograph. Film fog. Increased film density from causes other than exposure to the primary X-ray beam are scattered radiation, as I've said, that improper position of the X-ray source to the area of interest with the improper alignment of the X-ray beam, and improper safe lighting if there is not proper safe lighting, improper film storage, if the films are kept where there is moisture, so then there will be a problem. An expired film where the film has reached its age and it's not usable now, and the material, the emulsion and the base has expired inside it, kept in it with moisture absorbed, so that will create a film fog for the film. Then contrast. What is contrast? The contrast is the difference in the densities, that is the blackness, between various regions on a radiograph. So it is very well that where there is sharp demarcation of white and black and a little bit of gray scales are there, then it is termed as high contrast. The black and white are very few shades of gray, and there is more black and white, and this is best for caries dissection. Uh, Whereas low contrast has many shades of gray and best is for periapical or periodontal evaluation of the interpretation of the IOPA film. So this is long scale. Then we can see the various shades of gray over here. Then contrast is also influenced by the KVP, the exposure parameter, and the film contrast. Subject contrast results from varying object densities within the patient. This is determined by the thickness, density, and composition of the subject. So it's also the thickness of the object that we are taking a radiograph. It is determined by that, by the density and the composition of the subject. More restoration is there or less restoration. So that's how the contrast comes. So we again have to see the exposure parameters, have to adjust according to the patient, and we have to just uh, take the X-ray tube and the beam alignment should be appropriate. Then only the ideal radiograph will be achieved. Now KVP affects the penetrating ability of the X-rays. So over here we can see if we have kept in 90 KVP, then the well-marketed demarcation is seen of white and black, and little bit of gray shades are seen. If we keep at 80 KVP, then we can see there is a little bit demarcation, and in when we keep it at 40 KVP, we can see more shades of gray. So if we increase the KVP, then the penetrating capacity of the X-rays also increases. Film contrast. It refers to the characteristics of the film that influence the radiographic contrast. It is incorporated into the film by the manufacturer only. So there are fast films, slow films. So these are based on the exposure parameter and the time we are setting, that is MA per second, for the film to be for the film acquisition that we are acquiring. Film fog makes the whole film darker, making it harder to see density, and there is a differences in the contrast. So over here we can see the whole film has become dark, and then we cannot appreciate where is the problem of secondary caries in this radiograph, or where is the We cannot see the more shades of gray. The whole film is dark and hazy. So film, we should not incorporate film fog, and we should avoid all the things that cause the film fog, especially the scattered radiation. Your beam alignment, horizontal and vertical direction should be appropriate, and your source should be should you your exposure parameters should adjusted according to your source or subject. Then the film should be recent and it should not be expired. And then proper safe lighting you should use, and then develop the film. Sharpness measures how well the details of an object are produced on a radiograph. The fuzzy, unclear area that surround the image is termed as penumbra. So these are the very important terms that we need to understand over here. Penumbra means pene, almost, and umbra means complete shadow. So the zone of unsharpness along the edge of the images in a radiograph, the larger the penumbra, the less sharp the image will be. So the zone of unsharpness along the edge of the images should be reduced, and it can be achieved by various factors that I'm going to later discuss in this chapter. Supposingly, this is the focal spot, and this is the penumbra. So at the edge, where we can see more amount of scattered radiation, and this is the shadow that has achieved we have achieved complete shadow of the image. So this is the edges of the film reproduce the penumbra, and the shadow and the area of interest comes with complete shadow. Therefore, this image will be more sharp. Sharpness is influenced by focal spot size, source to object distance, object film distance, intensifying screen, film crystal size, and motion. So over here we can see decrease focal spot size, increase in sharpness. If this is the target, and we can see the image that is covering whole of the umbra is a little bit, and reduced focal spot is there, and little bit of penumbra is formed over the edges of the umbra, surrounding the umbra. And over here we can see larger film focal spot size is there, and more of the edges have more larger penumbra, that is the unsharpness has increased over here, and the shadow is less, so it will be not very sharp. So the sharpness of this type of focal spot will be compromised because it is large in size. Increase source to object distance, increase the sharpness. Target teeth is umbra and penumbra. So if we increase the distance, then the shadow will come exactly more, and slight penumbra will surround it. But if we decrease the focal spot size to the film, then we can very well over here see that the penumbra is more and the shadow that we have acquired is less. Decrease object film distance, increase sharpness. So we have to decrease the object film distance, and then the sharpness will be more. Supposingly we have to keep the film more near to the teeth, so it will give more sharpness as compared if the film is not kept more near the area of interest. So that may lead to more unsharpness zone, that is penumbra, and the shadow zone will be less. Now intensifying screen, decrease in the sharpness of the intensifying screen is also there. So if we use intensifying screen, some amount of scattered radiation is seen absorbed in the intensifying screen. This especially we use for extraoral film radiographs. So it, if we use extraoral radiograph, then there will be some compromised because of the intensifying screen, the radiation will be scattered, and some compromised sharpness will be there of the image quality. Film crystal. The faster film contains larger crystal size that produce less image sharpness and vice versa. So we should take medium fast film. So unsharpness occurs because the large crystals don't produce object outline as well as smaller. So there are less target areas in larger crystal size, and in small crystal size, more targets are seen. So image acquisition, that is the latent image acquisition, is much better in small crystal size film as compared to the large crystal size film. And patient motion decreases the sharpness of the X-ray film. If the patient is relatively in a motion from its position, then the sharpness of the film is also affected. Magnification. Increase in the size of magnification can be affected by source object distance and object film distance. So two important things are there in magnification. First is your source object distance and then object film distance. So magnification over here, we can see this is the target and the 16 inches is there. So this is increased distance of the source and the film. So if we have 16 inches of the distance, so there less is the magnification. And if the target is very near, that is in 8 inches, then more chances of magnification is seen. Decrease object film distance, decrease the magnification. If we decrease the object film distance, so this will decrease the magnification also. So 16 inches is the ideal distance of source and film that can be taken and recorded. Distortion, change in the true shape or size of the object affected by film teeth relationship and beam alignment. So best is the paralleling technique, that the image is parallel and is 16 inches, that is the film and object size are kept at approximate distance, and then the X-ray beam is passed. So this is the ideal technique of taking a radiograph, that is the paralleling technique. Then the bisecting angle technique, again the image and the source distance is the object and the source distance is compromised over here. It is 8 inches, and sometimes magnification can also be seen if the distance is not appropriate as 8 inches. And it follows the Chizinski rules that it has to make a triangle that is equal. So bisecting angle, if not taken properly, creates more magnification sometimes. So beam alignment is also very important. If the beam is more parallel, the image will come exactly. Supposedly, if we have taken a metal over here on the cervical region of the tooth, and then we have taken the radiograph, if more parallel, then more accurate image will come. If it is more, if the beam alignment is more vertical, then like this radiograph will come of the radio. This is the radio opaque object, that is your lead ring. And if we take the beam alignment, the vertical alignment is there, then this type of thing can be seen. So the beam alignment is very important with the proper vertical and horizontal angulation should be kept in mind. For particular teeth, there are different vertical and uh, horizontal angulations, and you should know them so that it will be easy for you to understand which tooth needs which type of angulation. So for ideal radiograph, image size should, as object should be there, image same shape as object should be there, image should have good detailing, image has good density and contrast. So all these factors are important for an ideal radiograph. So this is the mandibular molar periapical film, closest to the satisfying properties of an ideal radiograph. Either you can take by bisecting or by paralleling technique. How to identify the position of the periapical film? So embossed dot should be on the line of occlusion and identify the right, left, and the anatomical landmark to identify the jaw and the region of the area. So we always check the embossed dot, where the embossed dot is there. It should be towards, always towards the occlusion, and we should then check it is of the right side or the left side by the embossed dot. So it's very helpful in determining the left and right side. When you will come for practical more, if we have the opportunity, then it will be understood very well. So this is the upper right premolar, and these are lower anteriors. Image sharpness and resolution. How well a boundary between the two areas of differing ratio of density is revealed. So sharpness is that, and image spatial resolution, how well a radiograph is able to reveal small details that are close together. So X-rays are produced at the target in an X-ray tube and originate from different points and travel in a straight line. Their projection of a feature of an object do not occur at exactly the same location of an image receptor. Image of the edge of an object is slightly blurred rather than sharp. So this is the, as we said, small focal site, small focal spot is much affected. So this is the large focal spot over here we can see, and this is the very small focal spot over here we can see, and this is our object. And the area of unsharpness is more in the large focal spot as compared to small focal spots. There are three means to maximize image sharpness. Use as small effective focal spot as practical. So over here we can see that the actual focal spot is over here, and effective focal spot is being encountered over here. So we should keep a focal spot in certain angulation that it forms an effective focal spot over here. So decreasing the angle of the target perpendicular to the long axis of the electron beam decreases the actual focal spot size and decreases the heat dissipation, thereby tube life. So over here we can see this is the angulation. So less angulation increases the effective focal spot. So we should keep the angulation more parallel as compared to vertical and horizontal to the film that we have to take to our object. So decreases the angle of target perpendicular to the long axis of the electron beam. Then what is line focus principle? It is a very important principle given by Benson. So the line focus principle is developed in 1918, is a method of reducing the effective focal spot size. As the angle of the target face is made larger, the projected focal spots become smaller. When the rectangular focal spot is viewed from below, where the film would be located, it appears nearly square. That is, the effective focal spot becomes very small, which is only a fraction of the size of the actual focal spot. So if we keep make a film, the principle is based on at the angle of the target face is made larger. So if the angle is wider and larger of the target, then there will be a creation of a small focal spot. The ideal angulation should be of the face of the target to the central X-ray beam, usually 10 to 20 degrees. Using the X-rays at the angle, electron stream is spread over greater area, and radiographic definition is improved while the heat capacity of the anode is increased. So the at certain point, that is 10 to 20 degree angulation of the focal spot where the X-ray beams collide, so we should keep an proper angulation. This causes the effective focal spot to be almost 1 into 1 mm as opposed to the actual focal spot, which is about 1 into 3 mm. So this how we can reduce the size of a focal spot. However, the results in a larger effective focal spot and loss of image clarity. A small angle has a greater bearing effect on the target but results in a smaller effective spot, decreased unsharpness and increased image sharpness and resolution. So small angle should be made to, to anode and the focal spot. So it is inbuilt in our X-ray machines nowadays. Increase the distance between the focal spot and object by using a long open cylinder. So now we have to increase the distance between the focal spot and the object by using long open ended cylinders. The long focal spot to object distance minimizes the blurring by using photons whose paths are almost parallel. So we use a collimator also. And the benefits of using a long focal spot to object distance support the use of long open-ended cylinders as aiming devices on X-ray film machines. The position indicating device that we see in the X-ray machine should be long and cylindrical, that more X-ray beams should be in the beam alignment and passes and hits the target. Minimize the distance between the object and image receptor. This is the result of the minimizing the divergence of the X-ray photons. Thank you. I hope you have understood the class, and the geometric distortion can be minimized by appropriate exposure factors, and we can reduce the magnification by these principles. So try to imbibe all these things in the book it is given, and thank you for patient listening.